Parathyroid carcinoma is a very rare cancer that starts in one of the 4 tiny glands behind the thyroid, the parathyroid glands. These glands act like a thermostat for calcium in the blood. When they become cancerous, they can make the body keep too much calcium, which can cause many problems. Think of the gland as a small heater that suddenly gets stuck on high. It keeps turning the heat up even when it should not. The exact cause is not known for most people. Sometimes it runs in families because of mutations in certain genes, such as CDC73. Exposure to high levels of radiation to the neck area can also raise the risk. Most cases happen without any clear trigger, just like many other cancers where the cells quietly change over time. People with parathyroid carcinoma often feel symptoms that come from high calcium levels. Very thirsty and needing to pee a lot, like after drinking a big glass of water. Muscle weakness that makes simple tasks feel heavy. Bone pain or fractures, as if the bones are softer. Kidney stones that cause sharp belly or back pain, similar to a tiny rock stuck in a pipe. Mood changes or confusion, because the brain also senses calcium changes. Doctors first check blood for very high calcium and high parathyroid hormone, PTH. Imaging tests such as neck ultrasound, CT scan, or sestamibi scan help locate the enlarged gland. If cancer is suspected, a fine needle biopsy can be done. But the most reliable proof comes from removing the gland and examining it under a microscope. The main treatment is surgery to take out the whole affected gland and sometimes surrounding tissue. After surgery, medicines that lower calcium, like cinacalcet, may be needed, and close follow-up with blood tests is essential. In rare cases, radiation or targeted drug therapy is tried when the cancer cannot be fully removed. Because the cause is often unknown, prevention focuses on early detection and risk reduction. Avoid unnecessary radiation to the neck. If you have a family history of parathyroid problems, talk to a doctor about genetic testing. Keep regular health checkups, especially if you notice signs of high calcium, excess thirst, frequent urination, bone pain. Maintaining a balanced diet with normal calcium intake helps keep the glands working smoothly, but it does not replace medical monitoring for those at risk. From this explanation, you just need to break them into segments, and for each segment return phonetic reading style of the segment. Genetic testing for CDC73 and other mutations helps doctors identify high-risk patients earlier. New drugs that specifically block the pathways the cancer cells use to grow are being tested in small clinical trials. Minimally invasive surgical techniques, guided by real-time imaging, aim to remove the tumor with less damage to surrounding tissue. Studies on the use of calcimimetic drugs like cinacalcet after surgery show they can keep calcium levels stable and may improve